Hello and welcome to Chairside Live. I'm Megan Strong.
And I'm Will Schmidt, Registered Dental Assistant here at Glidewell Dental.
And today's show is exciting. We're kicking off a brand new series with Dr. Chi.
All right.
And in this first installment, he's addressing some of the common problems and solutions that the dental team and then also the lab kind of faces when taking digital intraoral scans.
All right. Well, in this first episode, he's scanning number 30, just the quadrant. He's going to take a look at it and see if it's ready to go to the lab or to design with his own in-office mill. But first, we're going to talk about occlusion, margins, occlusal clearances, and the contacts.
Well, that's exciting. Let's not wait another minute. Let's get to it.
So once all of your scans have been captured, whether it's a fixed prosthesis, an aligner, or removable appliance, it's very important that before you send that case off to the laboratory, that you analyze the entire model to ensure that all of the data points are captured accurately. If anything is missing, that will lead to a restoration or prosthesis that just might not fit correctly. It might be loose, it might be too tight, the contacts might be a lot heavier than you would want them to be. So truly, what is the lab looking for? So that's what we're going to review in this next segment. How do we analyze the entire model together before you send it off to the lab for that accurate fitting restoration or prosthesis? So you've captured your digital impression. Now, before you send it off to the lab or to whatever service you're sending the STL scans to, you want to make sure you analyze your digital impression, your digital models first to ensure that you have all of the critical data points that the lab will need to create a precise fitting, accurate restoration. So we have our preparation. In this case, we have a single unit crown prep on tooth number 30, the lower right first molar. You can see it here, and the entire quadrant. So starting off with the entire model, with most of these type of cases, single unit posterior restorations or preparations, we want to scan from the last tooth forward to at least the canine. I recommend at least to the canine or cuspid so that you have data points, extra data points for yourself and the dental designer to create anatomy within the restoration that is true to form for that patient. Also, those extra data points to the mesial and distal will allow a more accurate recreation or generation of the bite registration for the patient. Without those data points over the adjacent teeth to the prep, the scanner is going to have a much more difficult time establishing the patient's occlusion. So we have most of the teeth that we want, again, the entire quadrant of the canine all the way back to the last tooth, in this case number 31. What areas of those teeth do we want to capture? So we want to make sure that the teeth are visible. On the occlusal, we have most of the data on the occlusal. The lingual surfaces are filled in well, and also the buccal surfaces are filled in well, and also the gingival margins. That just allows for a clean, accurate impression of our patient. Now, those surfaces are certainly critical, but an area we can't ignore will be the contact surfaces over the adjacent teeth. So in this case, number 29 and 31, the two teeth next to the preparation, those contact surfaces next to the prep also have to be filled in. If those are missing, the restoration is most likely going to be too wide mesial distally, and that would mean a lot more adjustments on your end when you're going to try to seat it on the patient. So making sure that's filled in will be critical. Next, probably the most important aspect of the entire quadrant scan for the prep is the prep. You want to make sure the occlusal of the prep, the axial surfaces of the prep, and the margins are all filled in so they're not missing any critical data points within it. If there are any holes within that, you definitely want to capture that and fill that in. Now for the margins, you want to make sure that the margins are visible, they're clean, and for those equigingival or even subgingival margins, that adequate retraction was accomplished, whether you're using laser, you're using retraction cord, or they have the retraction pastes, some method to move the tissue away from the preps so that the margins are visible. If you cannot see the margins at this point on your digital impression, how can you expect someone else down the line, the dental technician, to know where to position the margins? So it's going to be very critical that those are also visible within your digital model. So analyzing the entire model, making sure that you have accurate data points over the adjacent teeth, the contact surfaces of the adjacent teeth, and the entire preparation, nothing's missing, everything is filled in correctly, and the margins are visible. That's how you can ensure that your prep model is accurate enough for a precise fitting restoration to be created on it. So for the opposing, you can see here on the lower, I scanned again from the last tooth to at least the canine on the mesial side. We want to try to establish the same number of teeth on the opposing. So you can see I have number 6 scanned in here all the way back to number 2. So if we just analyze the opposing, the upper model here, we want to ensure that most of the occlusal and the buccal and lingual surfaces of the opposing model are captured. It's going to be very difficult for the dental technician or even for yourself if you're designing these restorations in office chairside. It's going to be hard for your design software to know how high to build the restoration if some aspect of the opposing dentition is missing. So again, making sure the occlusal, buccal, and lingual surfaces are filled in appropriately, and that way we can establish an accurate bite and occlusion for that restoration. Now in this restorative case, you can see I'm missing a little bit within this gingival embrasure on the buccal between 12 and 13, also on the lingual. For this particular case, a restorative situation is not critical on the opposing area. But if this case were to be used, if it were a full arch scan, if it were to be used for a removable appliance like a sleeve appliance, certainly with aligners, clear aligners, you want to make sure that all of the areas within the embrasures, the gingival embrasures, are also filled in. But in this case, a restorative case, most of the occlusal, buccal, and lingual will be sufficient. So once you analyze that information, many of the scanners today have some additional features. So in this case, the iTero element has an occlusal clearance function. So when I activate that occlusal clearance function, we can see some areas on the right here, or this area here that has a color map. It will reveal on the preparation how close it is or how far away from the opposing that prep is. There's a scale function for the iTero. I like to change the scale. Usually it will default to the last or third option where the range of revealed colors is between 1.1 to 2.3 millimeters of clearance. I like to change that to the middle option of 0.5 millimeter to 1.5 millimeters. And what that will do is just change the areas that are, the colors that are on the teeth. And right now I know with that setting, if there are any colors that are on the prep, it means that the prep is less than 1.5 millimeters of clearance, so clearance distance from the opposing. So at that point, you can make the decision whether or not to reduce a little more on the patient, and most likely you would need to. Most of the materials that we use today, whether through the lab or chairside, like the lithium silicate glass ceramics, even with Bruxer restorations, 1.5 millimeters is what we're shooting for to allow for adequate strength and also for the technician or the design software to create occlusal anatomy that conforms well to the patient's dentition. So it will give you more natural looking anatomy on your restorations. So that's a great feature, and with digital scans, before you send it off, you have the option of making edits to the digital model. You can go back, you can delete areas that are not reduced enough, you can delete areas that may not have been retracted enough. That's one of the most wonderful aspects of a digital impression system, being able to edit your digital models before they get sent off to the lab. So that's how you want to analyze your models. It's not just a matter of going through the sequence, positioning, of course all of that is important, the fundamentals of keeping things dry, positioning where you need the camera to capture the data, but analyzing the model is going to be an important aspect of using your digital impression system to ensure that you're getting the most accurate representation of your patient's dentition for that precise fitting restoration or appliance that you plan on using. Thank you so much for your time.
Well, thank you so much for that, Dr. Chi. And stay tuned for future episodes in this series where Dr. Chi is going to dive deeper into common problems associated with these types of scans.
Well, I can't wait for that. But for today, we're all wrapped up here. So on behalf of everyone here at Glidewell Dental, thank you so much for watching.
And we'll meet you right back here next time.